Hello, my name is Dr. Dawn Hyman. I'm an audiologist, and I have been working in helping people for over 15 years who have hearing loss, tinnitus, balance disorders, and you're probably wondering, why in this three-part series are we talking about ears and hearing? And I'm going to talk to you about how hearing loss can be very isolating. It can actually exacerbate a problem of wondering whether or not your parent should be independent anymore. Some studies are also showing that hearing loss is being linked to dementia. They've done MRIs, functional MRIs, cognitive testing through Johns Hopkins University, the University of Pennsylvania, and they're finding that there's actually brain matter that's dying in people at a faster rate who have hearing loss. So let's just look at hearing. When it comes to hearing loss, everybody wonders, well, why is it important? Most people think, well, you can see vision, you need to wear glasses, but what about hearing loss? 2/3 of all Americans over 75 have a hearing loss. And 85% of those people aren't doing anything about it. And people say, well, it's because hearing aids are so expensive, why bother? But you know what? If you go to Great Britain and they have a socialist health system, hearing aids are paid for. And they have the same 15% hearing aid use rate as the United States. So it doesn't have, those hearing aids are free in Great Britain, and here people might have to pay for them. But we wonder, why aren't people doing something about their ears? So I'm going to give you some good reasons why someone should get their hearing tested and make sure that they're hearing their best. If we had a child who has hearing loss, especially if they're in grade school, they're in middle school, everyone, all of their educators, the parents, the doctors, everyone knows and agrees this child needs to wear hearing aids. If we have John Smith, who's 12 and he's not wearing hearing aids, socially he can miss out a lot when he's at a school dance, if he's on the playground, he's in class. He could be academically failing because he's not hearing his teacher correctly. Even if he just has a hearing loss in one area, it's stressful for him. He's guessing, he's socially regressing because he's not keeping up with his peers. If John Smith is now a completely different person, the same hearing loss, and he's 67 years old, we say, don't worry about it. He's 75, oh, whatever, maybe you should think about hearing aids. He's 85, I don't know, how much longer are you going to live anyway? That's not the way to think. When you're 67, you might want to travel. You might still be working. You're commanding your family still. And the more you socially regress, the less you are that strong person that you always were. So when it comes to hearing, we hear with our brain, not with our ears. So it makes sense, if you're not funneling the sound and activating the brain correctly, that you can have some loss. So I want you to do something. Put your fingers in your ears and hold it there. And don't take them out until I tell you. But I want you to listen to me talk about how the ears need to be balanced. You need to hear what I'm saying. And I want you to know that in stereo you can process better, you can localize the sounds, you can follow what's going on. The signals have to get up to the brain, to the left temporal lobe, and you're probably wondering with your fingers in your ears, what is going on? I'm not learning. You now have a mild hearing loss. If you already had a mild hearing loss, you're now experiencing a moderate hearing loss. Go ahead, take your fingers out of your ears. And so I want you to think, what was the point of that activity? The point was, you couldn't really understand what I was saying. You were guessing. You probably took your fingers out of your ears. You turned up the podcast. But I want you to think about, what if that was every day? Every time I went to a doctor's appointment and they told me that, you know what, you need to take new medicines and everything's muffled, do you think I'm going to comply with the way I'm taking my medicines once I get home? I was straining to hear what's being said. I maybe went off in la la land not actually engaging in what was being said, or maybe I'm in a wheelchair and I'm sitting there and the doctor's saying blah 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 blah, and I think I hear cancer, blah blah blah. What's he saying? And we say, Mom, please be quiet, doctor's talking. And we squish that person down. We're suddenly not letting them be involved in their care, and it's very frustrating for them, and they get angry. Or they want to be involved in everything and we're telling them, please be quiet, you're interrupting. And then they're off mumbling to themselves, grumbling and all that, and we think, oh my goodness, she's losing it. Now what? Dementia, right? And this is something that affects our entire family. You have Thanksgiving dinner, you have, some sort of family party, you have a wedding, and they don't want to go. Or they sit in the corner and you see them off by themselves because it's too overwhelming to hear what's being said, so they just shut down. They become sad. A consequence of hearing loss is social isolation. Gerontologists have linked loneliness as one of the most important determinants of morbidity and heart disease, heart attacks. Think about it. If you're stressed, and then you are socially isolated, and then in your mind you start mumbling and grumbling, and you start being by yourself more, you start being more negative about you become paranoid, and all that stress can lead to hypertension, which can lead to heart attacks, which can lead to earlier death. Social isolation totally affects self-esteem. It affects relationships with families. There was a study that was conducted in the 90s, and it was published in May of 1999 by the National Council on Aging. And what they did was they sent out a survey, and this survey went out to people who were seniors, and they asked them, do you have a hearing loss? Are you doing something about your hearing loss? And then asked them questions about how they felt about themselves, about relationships with their families, and they then divided the responses of the survey into two groups: those that have hearing loss that don't wear hearing aids, and those who have hearing loss that do wear hearing aids. And this is a very significant study because it found that those who were not treated with hearing loss had higher levels of sadness and depression. Makes sense. They tend to worry and have higher anxiety. They were more paranoid. And they also said that they have more emotional turmoil and insecurity. Whereas those who have treated hearing loss reported that they now have better relationships with their families. They argue less. They have better feelings about themselves. They're more independent. They tend to go out more. They just felt better. Their mental health was improved by something so simple as hearing. And I don't know if I can do it now, but I'll see. If we play some music, it's amazing how if, let's say, suddenly Sinatra comes on, and you have an older person, and it's their favorite song, and suddenly you see their smile, they light up, and they're like, I remember dancing to this with my husband. Music alone can transport you to a different time. And I do it in a presentation with seniors where I have them close their eyes and we play different musics from different genres and actually have them just shout out, what does your hair look like right now? What kind of car were you driving? I had one woman that was like, car, I was riding a bike, and it just giggling, and they love music. The functional MRIs show that the entire brain lights up when you listen to music, and especially if you can hear it well. You're actively activating the brain. You're making them happier. When I first fit a patient with hearing aids, the smiles on their face, and they're saying, oh my gosh, that's so much better. Why did I wait so long again? Actually accepting hearing loss can take 6 to 9 years. And it's the same process that we go through if we're dealing with a death in the family, or even just having our driver's license taken away. There's first denial, I don't have a problem, and then there's the anger. Well, why me? Why does it have to be me? How come there's nobody else that has to deal with this? And then finally there's the grief and the crying, and then they're ready to accept. So when it comes to hearing, if you suspect that maybe someone's having issues with hearing loss, have their hearing tested. Put the onus on me or another doctor that says you have a problem. If we can start out with the diagnosis, then we can accelerate that acceptance process and they'll do something about it sooner. If you just make fun of them, sometimes it happens in families, oh, you weren't listening, well, you need a hearing aid, go get a hearing aid. Now it's just not a good situation and now you're the bad guy. Let me be the bad guy. If a professional tells them, then we can start revisiting it maybe every year, and look at little assistive devices. There are things like this. This is from Radio Shack, and I added some cute little pink earbuds. But this cost me, because our Radio Shack's going out of business, but this cost me $4.99, and I added simple headphones. It's a simple amplifier. I suggest that you take this to all appointments. If they're having a problem hearing and they don't want hearing aids yet, at least then you can turn up the volume and they can participate in the conversation. They go to the doctor's appointment, they know what's being involved. You're looking at a new facility or possibly interviewing a caregiver, and you want them involved because they're not going to buy in if they feel like everyone's against them. They need to be given that self-respect and that esteem where, Mom, we want you a part of this. Here, just put this on and you'll hear better. You want them to buy into all of this and you want them to feel a little more confident. Worst case scenario is they're living by themselves. And I've heard this so many times. They're living by themselves, we're on a family trip, Mom's not answering the phone, we send the neighbor over, they're banging on the door, Mom's not answering the door, we have to call the police. And the police comes and they crawled in through the bathroom window to get in because they didn't want to break the door to find out Mom's sitting there watching TV going, what are you doing here? What do you mean? I hear fine. What? And the TV's blasting. She can't hear a thing. Why are you so upset? And, finally they get the child on the phone. They're like, Mom, we thought you died. And they're like, I'm fine. Maybe you should get your hearing checked. I don't need to hear anything anyway. And then there's all that panic. Do you want to go through life like that? I don't know. So at least getting their hearing checked would be a great start. The studies out of Johns Hopkins University are definitely showing that with at least minimally 25 decibels of hearing loss, you're going to have a cognitive delay that is about equal to 7 years of aging. So if we have two people, one person has normal hearing, the other one has a 25 decibel hearing loss, we move forward, over time, that person is going to start acting older than their peer that has normal hearing. Every 25 decibels. So if someone has a moderate hearing loss and it's 50 decibels, they're going to act 14 years older than their peer. It's amazing, some of these studies where they followed 2,000 adults over the age of 70 for 15 years, and they found that the subjects with hearing loss had a 30% faster rate of cognitive decline over 6 years. Now, I know that right now the biggest concern is staving off dementia or trying not to go down that path of Alzheimer's disease. This is something to look at. And I know that there is now a national awareness about how hearing loss and cognitive problems are now being linked. The Mayo Clinic requires you have your hearing tested before you have any kind of dementia study or workups, because most of those questions are verbally given. If we don't know how they're hearing, how are we supposed to give them a verbal questionnaire? Overall, I highly recommend that you do your best with your family. If you suspect that there's a hearing loss, have something done. I can provide you a complimentary evaluation. In this series, we're going to be discussing how caregivers and also caregiver support is available. And this is just one little aspect to look at in how you're communicating with your family member. And if they're not communicating well with you, you could really have some problems. So again, my name's Dr. Dawn Hyman. If you need anything, just let me know. Thank you.